For reaction out of the president's comments on health care reform, we're joined by members from both sides of the aisle.
Democratic Congressman Peter Welch of Vermont and Republican Congressman Charles Bustani of Louisiana, who is also a doctor. Thank you both for joining us. Dr. Bustani, I'll begin with you since you are a doctor. Tell me what you think of the plan and what you thought of the comments today.
Well, first of all, as a physician with over 20 years of clinical experience, what I'm really interested in is the highest possible quality for all Americans with regard to health care. That means we need to get Americans access to a doctor to develop a doctor-patient relationship, and that's the only way we're going to get a handle on the cost in the long run, because where the doctor and patient meet and work together, that's where costs are incurred, and that's where you develop quality. And so that's really what I'm interested in. And so I have some deep concerns about some of the proposals that are out there because they seem exceedingly expensive. They're going to be very expensive to the taxpayer and may not meet those standards of high-quality health care.
Well, and of course, Congressman Welch, one thing that keeps prices down is competition. We have 1,300 insurance companies, some of them worried about the influence of a government insurance policy. The president spoke to that. Let me play you a clip of what the president said and get your reaction.
Be some, I think, legitimate debates to be had about how this private plan takes shape. But just conceptually, the notion that all these insurance companies who say they're giving consumers the best possible deal, that they can't compete against a public plan as one option with consumers making the decision what's the best deal, that defies logic.
Well, Congressman, he says it defies logic. On the other hand, the public option doesn't have a profit, doesn't have a bottom line it has to worry about. Insurance companies do, and when they're competing with an agency that has no bottom line, no zero, endless pockets, doesn't that put them at a competitive disadvantage?
You know, if the healthcare system has to be about getting access to healthcare to Americans, and the path to accomplishing that is by bringing down the cost. And frankly, the private insurance companies have not been successful at accomplishing that. So what the president's proposal is about giving Americans another choice, introducing competition so that if you have a public plan that, let's say, can have lower administrative costs and where it is going to ratchet up savings, not by getting in between the doctor and the patient. Charlie makes a good point on that. But by finding savings in the medical system so that you're not doing unnecessary care, that's a good thing. You know, we cannot have the cost of health care increase 2 or 3 times your wage growth, profit growth. It's got to come more in line with inflation in order to have this be sustainable.
And Dr. Bustani, one of the things the president did say today is that, in essence, if you like the plan you're with and you like what your employer is offering or whatever it is, that you can choose to stay with that. Can you sort of bridge the gap between that and then this concern that doctors might be harmed in some way, in that when you're trying to bring down the costs, doctors are already down for the count when it comes to basic office visits?
Well, yeah, you're right about that. And here's the thing. If you listen to what the president said, it's not consistent with that concept of if you like what you have, you can keep it. Because clearly what the Lewin Group has shown is that millions, probably 120 to 170 million folks will migrate off of private insurance into this government option. And also at Medicare rates, you're going to lose doctors. Doctors who are still in business are going to be losing cumulatively about $36 billion annually. Hospitals will lose $33 billion annually. And what you end up with is a healthcare system that's stressed. The providers are not going to be there to take care of patients. And this is going to be a real disruptive event. I believe that the president set up a false dichotomy and that we have too much restriction in the insurance industry. And if we opened up competition in the insurance markets with some very sensible changes, we could actually improve the healthcare system at a much lower cost to the taxpayer and to the American public at large.
Congressman Welch, I want to go to you also about the question of whether we will end up with a single-payer system. As you know, Barney Frank has said he favors a single-payer plan, something like Medicare for everyone. The president said that's not what he is aiming for. What would you like the president to aim for?
Well, I want to aim for an affordable health care system that gives good quality care to all Americans, and how we get there is of secondary importance. You know, I hate to argue with the doctor, But when I talk to my doctors back home, one of the things they are really frustrated about is the paperwork that the insurance companies require them to do.
Yes.
And they have an insurance company person getting between them and giving the care that the patient needs. One of the potential opportunities of a public health insurance plan is that people can vote with their feet. If they like the option and it's better, then that's a real good indicator that Americans are getting what they want. The second thing that I'm hearing from is business. Our folks in Vermont, small businesses that have been trying to provide health care to their workers because they know how important it is, they can't afford it anymore. And it is a crisis. And in Vermont, we had a Republican governor, Democratic legislature. The Democrats generally focus on access. The governor focused as a Republican on cost. You know what? We were both right. In order to get to access, we have to control cost. And I think that's the heart of what President Obama is proposing.
I love it when you two guys look at each other.
Yeah,
That makes it much more exciting. We're gonna focus on it. Give our guests stage instructions from now on. Thank you, gentlemen.
Hey, can we get you both back again to talk about this? It's a great team with both sides of the aisle represented.
Well, I'll check with Charlie.
Sure, we'll be happy to come back. Okay.
Got to get our
Thank
permission
you.
slips.
Thank you so much, Representative Peter Welch and Representative Charles Bustani, who is also a physician. Thank you both.